Hello and welcome to today's webinar. This is the second webinar in our medical self-care webinar series. This is phase 1 of the 3 phases of medical self-care. My name is Madison, and without further ado, let's get started. I want to start out the presentation by making sure that everyone knows that we're doing this presentation because we care about you and your health matters. Okay? The healthcare system is strained and broken. If you remember or were attending the first webinar, you know that our system is very broken and very strained in the U.S. here, and we just want to make sure that you are getting the most out of your healthcare and that you're navigating your way through this system in the best way possible. So I want to start off by making sure that everyone is on the same page with what medical self-care is. Medical self-care is what a person does to recognize, prevent, treat, and manage health problems on his or her own. And today, as well as the other webinars, we are talking about actually recognizing and preventing and managing health problems, but we're also talking about the healthcare system as a whole and a lot of other aspects of it as well. So to review, the 3 phases of medical self-care include phase 1, collecting and contacting. Phase 2 is about recognizing and reacting, and phase 3 is all about preparing and performing. Phase 1 we're going to dig into today, and phase 1 has 2 parts. Collecting and assembling a personal health history is the first part, and then the second part is contacting and securing the right primary care physician. So let's get started with the first part, collecting and assembling a personal health history. And I want you to get this burned into your brain. You may have remembered this from the first webinar, but it's so important that everyone understands that 95% of your diagnosis is based on your medical history. And this is a crazy stat, especially considering that 99%, so almost 100% of all medical histories are incomplete or inaccurate. So that means if you were to go right now and request your medical record at your doctor's office or your local hospital, most likely there is going to be missing information, inaccurate information in your medical record, which is very scary because the next time that you go in for a doctor's visit or heaven forbid an emergency happens and they're relying on your medical health history, it's most likely not complete. And your diagnosis is based on your history. So it really is a big deal and very, very important to have a personal health history that you have created yourself to ensure that all of the correct and proper information is in it. So if you go to the next slide, this is an example of a personal health record and what would be in that personal health record. And at the end of the presentation, I'm going to tell you where you can get this exact personal health record to make sure that you, in fact, do have one that you can complete. So this personal health record would have information on, of course, your contact information about your primary and secondary emergency contacts. And this is so important because a lot of times people only include information with their primary emergency contact, like their spouse or their parents. And if those people are with you when you have an accident or something does happen, it's really helpful to have multiple secondary emergency contacts. So make sure that you have those in there. Your primary insurance company, all medications that you're on or have been on, and allergies as well. All medical and family history, very, very important. All the emergency numbers, like I mentioned, who your primary care physician is, and these last two, not a lot of people think about all the time having in your personal health record, but important healthcare events, really, really great to have in here. Obvious ones like having a baby, or if you had surgery, or you had a heart attack, of course you want those in there. It's surprising how some things can be missing if there is a move between hospitals or whatever it is. And vital health statistics can be really important too, like if you had an anxiety attack or you gained a lot of weight, you lost a lot of weight, maybe you had an injury that you didn't go to the doctor for, but you self-medicated and anything like that. It's just really important to have anything and everything in your personal health history because you never know when you might be really depending on this information. Frequently asked questions that we get are the results from my health risk assessment enough? And the short answer is no. Although the health risk assessment asks a lot of good information about your daily health behaviors, you want the information that we just covered on there, your family history, your contact information, all of those things are so important that your HRA is not going to be enough. And two other things that I want to talk about today. You might say to yourself, why are we talking about this in medical self-care? But we're going to talk about an advance directive and why it is so important and how it really does connect with what we're talking about today. So an advance directive is two things. It consists of a living will and a power of attorney for health care. And most people do not have an advance directive, and these things are so very, very important because if something were to happen and you were in an incapacitated state, these are going to be so very, very important, okay? And what a living will is it is a legally binding document that states your wishes if you do end up in an incapacitated state and you're not able to speak for yourself. And then a power of attorney for healthcare is a representative that would help to instate your wishes that are in your living will if you were in an incapacitated state. And if you don't have these in place, your doctor or your family or friends may be able to make that decision for you. However, you really run into trouble if not everyone agrees what the right thing to do for you is, and if you can't speak for yourself. And a great example of this is the story of Terri, and you may remember this from years ago. It's a really big story, and it's a really sad story, but it is a great example of what can happen, the consequences of not having a living will. And the story goes in 1990, Terri collapsed and was automatically in a vegetative state. And for years, she was in a coma, and they tried to bring her back, and she had a feeding tube, and she was only staying alive from the feeding tube. Okay, her brain was essentially dead. And finally, 8 years later, her husband petitioned to get the feeding tube removed. However, her parents did not feel the same way as her husband. So this battle went on for 3 years, and then finally in 2001, her husband was able to get the tubes removed, but then 4 days later, the court changed their mind and they re-administered the feeding tube. And this went on, and it's crazy, but 15 years later, in 2005, the courts finally ruled that the tubes should be removed, and Terri passed away. And if you can just think about this, if this was your family, the stress and the just immense amount of pain and suffering that they went through for 15 years, and hindsight's 20/20, but if she would have had a living will, a lot of this might have been a lot easier. So let's learn from stories like this, but unfortunately we have a long way to go. There are only, on average, 3 in 10 Americans that actually have an advance directive in place right now. So we do have a long ways to go. And all of this goes back to being prepared, having a personal health record, having a will, just taking charge of your health and not relying on the courts or the health system or anyone else to take care of you when you're going to need it the most. I mean, we're going to have to depend on other people, of course, in some of those situations, but best prepare yourself and best help prepare those doctors and family and friends and the law when you do have that emergency, if you do, by having a personal health record and a living will in place. So if you have if you have gotten your personal health record created and assembled, that's so great. Good for you. Now let's make sure that you are putting it to good use. Who gets it? You want to make sure that your physician and your healthcare providers have copies. Your significant other needs to have immediate access to it, and you should also provide copies to any other trusted advocates in case of an emergency. Now, I'm not saying that you should give it out to everybody because it is very private and confidential information. However, in case of an emergency, it's very smart to make sure that these people do have access to these records. And if you're not able to get all your information from your current record that you might have or just by memory, and you need to access your medical records, you're in luck because you have that right. They're yours. You're going to most likely have to make your request in writing, and you should probably expect to pay a fee and expect it to take time. But by law, you should get an answer within 30 days, and the process should be started. And like I said, take advantage of this because these are your medical records and you have every right to have access to them. Another frequently asked question is, can I keep my personal health information online? And after a lot of research, my personal advice is to proceed very carefully and cautiously about this. You may have an insurance provider or a medical system that you trust very much, and you can have a lot of faith that their system is secure and you can trust them, and so you might be able to do that. But you never really know with online formats, and it's certainly not smart to just put it into any online personal health collection system. So it's really smart to just have it in a written format and in the hands of only the people that you trust. So that takes care of our first objective, why every employee needs to collect and assemble a personal health history. Let's get into the other half of phase 1, making it clear why every employee needs to contact and secure the right primary care physician. So there are 4 reasons we're going to talk about why you need a great primary care doc. And I have great bolded and in caps because I'm going to challenge you right now to think about your current primary care doctor if you have one. And though they might be good and you might think that they're great, I challenge you to really think about what we're going to talk about in the next couple of minutes about the qualities and characteristics that a great doctor really should have. And think about the kind of care that you're getting, and if you really should maybe think about getting a new doctor, or if your current doctor is truly meeting the needs that you have. So first one, a great primary care doctor will watch out for you in a complex and strained system. As we talked about, the U.S. healthcare system is strained and has a lot of problems, and a great doctor will look out for you and have always your best interest in mind, not their best interest in mind as far as money and convenience goes. They will instead have your best interest in mind. They'll help you with referral to specialists. If your doctor refers you to a specialist that's out of network, that's probably going to cost you 2 to 3 times what it would cost to be in network. So that's just a great way to kind of see if they're really looking out for you. Making sure you're getting the right diagnosis and the right treatment. You may want to get some second and third opinions just to kind of see how your doctor is measuring up. Always a good idea. And lastly, keeping you on track with preventative screenings is what a great doctor will do, because no matter what age you are, prevention is so important. If you can prevent something before it happens, or see where you're trending, or prevent something from getting worse, that's one of the best things you can do for yourself. So if your doctor isn't talking to you about preventative screenings, that's a red flag. Also, I want you to consider this. The average primary care physician has 2,500 to 4,000 patients. That's a lot of patients. They work 5 to 7 days a week. They take ER calls 24 hours a day, and they often see patients on the weekends as well. And you might not be able to escape this when you are looking for a doctor, but it's important to know what kind of patient load that your doctor has and ask yourself, are you going to be getting the care that you need with this doctor and their patient load that they have to fulfill? So here are some ways that can help you figure out who the right primary care provider for you is. And the first thing you're going to want to think about is expertise. If you have a specialty area that you are going to need more assistance in, and you just know that you're going to need more care in a certain area, it's probably important to find a doctor that has an expertise in that area and is able to give you the right extra care. Communication is so important. It is very sad when you learn about what little communication education that med school students are getting. They're getting almost no communication teaching. And communication is so important between a doctor and a patient. So if your doctor isn't communicating with you effectively, and he or she is not answering your questions the way you need them to be answered, and they're not getting the information to you in a way that you can understand and apply them, that could be a big deal. So make sure that you can communicate effectively with your doctor. Patient load, as we said, might not be able to avoid this, but always important to recognize that when choosing a doctor. Approach to treatment is important because there are generally two types of doctors, groupers and splitters. And splitters take different symptoms that you might have and they might refer them to different specialists. They'll split them up. Whereas groupers might take if you're complaining about a few different symptoms, and they'll group them together and they'll maybe try and figure out, okay, how are these connected? Is there one thing that's causing all of these? How can we, figure this out all together? I personally like groupers, but you might like a different approach to treatment. Either way, important to know what your doctor's approach is and if that matches with yours. And of course, overall compatibility is so important. You want a doctor that you can feel comfortable with, that you can not be afraid to ask questions and speak honestly with. So very important to have overall compatibility. Another clue that you could use in finding the right primary care physician is an intake form. Although personal referrals can be really helpful, and I've actually used that strategy myself, trying to see who other people like and things like that, the intake form can actually be very helpful, and I'm going to tell you why. This is a quote from Roger Greenlaw from the Swedish American Hospital. Really good primary care physicians want to know somewhere between 5 and 20 pages of information about you before you come in. So if the intake form only asks you about your age, where you work, what your insurance is, this applies that you are only going to get symptomatic acute care. And like we talked about, the more information that you can give your doctor, the better care that you are going to be able to receive. So between your personal health record and making sure that your doctor is asking for a lot of information from you with the intake form, you know that your doctor is going to be able to give you a good diagnosis when you go in, because 95% of your diagnosis is based on that information. So we've covered both of our objectives for today in Phase 1, collecting and assembling a personal health history, and then contacting and securing the right primary care physician. This concludes Phase 1, and Phase 2 and 3 will be addressed in the upcoming months in our last 2 webinars. If you don't have a personal health record, you can access this on your company's web benefit page. It's in the My Company tab in the latest resources section. And if you're not able to locate it there, you can email us at the email I'm going to provide in a couple minutes, and you can always immediately have it sent to you that way. And last, I want to just touch on the Medical Self-Care Incentive Program we have going on associated with these webinars and other things that we're doing with medical self-care. And you can start to participate in this incentive program at any time. It's just a survey. The Well Day workshop training was the initial training, but you can also view that via webinar and get points that way. We have monthly newsletters we're sending out and quizzes that you can get points from. And then you also just get points from creating your personal health record as well. And this is the first part of the medical self-care webinars in Phase 1. There's also an extra of doing practicing medical self-care and submitting a testimony of a time that you were able to use this information that you learned throughout these webinars or this program, and you actually put it to use in your everyday life. And so if you have a testimony like this that you think might help other people, we'd really appreciate that. And you can win prizes for all of your participation in our Medical Self-Care Incentive Program. All right, thank you for listening today. And again, if you have any questions or would like to receive the personal health record, just email us at livewell@babbins.com. Thank you so much, and we will see you next time.